ओके हेलो गाइज है आज चाहिँ हामी पेक्टोरल रिजनको एनाटोमी पढ्दैछौँ है सो सुरु गरिहालौँ है सो दिस इज द पेक्टोरल रिजन इज द सिम्पली इट इज द फ्रन्ट अफ चेस्ट है सो पेक्टोरल रिजन इज द फ्रन्ट अफ चेस्ट सो फ्रन्ट अफ चेस्ट तिम्रो छातीको अगाडिको भागलाई चाहिँ पेक्टोरल रिजन भन्दो रहेछ है सो आज चाहिँ अब बेसिक मसल होइन त्यसको सँगसँगै क्लिनिकल एनाटोमी कम्प्लिट एनाटोमी नै पढ्नेवाला छौँ सो हेर्दै गर है सो दिस इज द लार्ज prominent muscle you can see in the pectoral region. This large prominent muscle you can see in the pectoral region is the pectoralis major. It is a large prominent muscle, and this is the pect major. This is the pect major, major, and this is the deltoid. So this is the deltoid. This is the deltoid, and this is the trapezius. This is trapezius. This is the sternocleidomastoid. Sternocleidomastoid, hey, and or so this is the clavipectoral fascia. Clavipectoral fascia. This is the clavipectoral fascia, hey. So overview मात्र दिया है. So फेरि कुरा आउँछ तिनीहरुको. These are the arteries that supplies the pectoralis major. Okay, so this is the pectoralis major and there is the deltoid. So pectoralis major originates from the clavicle, है. Clavicle बाट originates भएको छ, from the sternum बाट नै originates भएको छ, and from the costal cartilage also, है. Costal cartilage बाट नै originates भएको छ. So pectoralis major को दुईटा हेड हुन्छ. So pectoralis major, है. Pectoralis major. This is pectoralis major. So pectoralis major को origin हेर है. So pectoralis major को origin मा it has two heads, है. Two heads दुईटा टाउको हुन्छ भन्नुको अर्थ. एउटा चाहिँ clavicular head हुन्छ. One is clavicular head, one is the sternocostal head. Sternocostal, है. So there is clavicular head and sternocostal head. So clavicular head originates from the clavicular part मा चाहिँ कुनबाट हुन्छ भन्दा anterior surface. This originates from the anterior surface of medial half of the clavicle, medial half of clavicle, है. So clavicle को anterior surface को medial half भन्यो. Okay, so yeah, so this is the anterior surface, है. This is anterior surface and the medial half, okay. So medial side को half र anterior surface बाट चाहिँ originate भएको छ clavicular head चाहिँ, हैन. The sternocostal head चाहिँ arises from the anterior surface of the sternum, anterior surface, anterolateral भन्ने हुन्छ, anterior surface of sternum, है, anterior surface of sternum, and the upper six costal cartilage, है, upper six costal cartilage. So upper six costal cartilage and the external oblique muscles aponeurosis, external oblique muscle aponeurosis. So aponeurosis is the flattened tendon, है, flattened tendon, external oblique muscle को aponeurosis बाट, upper six costal cartilage बाट, anterior surface of the sternum बाट, है. So यसरी चाहिँ sternocostal head आउँदो रहेछ, है. Yes, I already said it is a bulky muscle. It is a bulky muscle. It has two heads. One is clavicular head, and another is the sternocostal head. Clavicular head is anterior surface of medial half of the clavicle. Sternocostal head is anterior surface of the sternum. Upper six costal cartilage and external oblique muscle aponeurosis. So this is the origin, है. So this is the origin, and there is the insertion, है. अब insertion कहाँ हुन्छ त? So insertion कहाँ हुन्छ भन्दा there is the insertion of the lateral lip, है. Lateral lip of bicipital group. Lateral lip of bicipital group, है. So bicipital group मैले आम पढ्दा पनि भनेको थिएँ, bicipital group, है. So lady between two majors भनेको थिएँ, है. Lady between two majors. So lady को लाबाट latissimus dorsi, which is inserted in the floor of the bicipital group, and two majors भनेको, so lateral lip मा चाहिँ there is the insertion of the pectoralis major, and medial lip मा there is insertion of teres major, है. teres major, okay. So teres major pectoralis major को बीचमा lady छ, lady भनेको latissimus dorsi, है. So this is the muscle of the chest. This is the most bulky muscle of the chest, that is the pectoralis major, that has a clavicle head, anterior medial surface of the clavicle, and there is the sternocostal head, and from costal cartilage, and the aponeurosis from the external oblique muscles, and inserted in the lateral lip, है. Lateral lip of the bicipital aponeurosis, bicipital group, है. Bicipital group को lateral lip मा छ. And there is another muscle, है. So action पनि nerve supply action, also nerve supply action. So pectoralis major को nerve supply, है. Pect major को nerve supply, it is supplied by lateral and medial, है. Lateral and medial pectoral nerve, है. Medial pectoral nerve. So lateral and medial pectoral nerve supplies the pectoralis major. So lateral pectoral nerve is a branch of lateral cord of the brachial plexus, while the medial pectoral nerve is a branch of the medial cord of the brachial plexus, है. अनि pectoralis major को action, okay, action is also important. It is the it helps in the adduction, है, adduction of arm. It helps in adduction and the medial rotation, of humerus. है. So it helps in the adduction and the medial rotation of the humerus. action है. It is the flexion of an arm. It is also this clavicular head है. This is the clavicular head, and this clavicular head of the pectoralis major is also a weak flexion of arm. Weak flexure of arm. It's a weak flexure है. Weak flexure of arm. So it has got three functions. There is adduction of the arm, there is the medial rotation of the arm, and there is the weak flexion of the arm. Okay, three functions है. So त्यस्तै गरेर अर्को एउटा छ पेक्टोरालिस माइनर भने जस्ट beneath the pectoralis major है. There is the pectoralis minor है. This is the pectoralis minor. Okay, this is the pectoralis minor. As you can see here, this is the pectoralis minor है. This is the pectoralis minor. Okay, and this is the biceps brachii. Okay, यो चाहिँदैन अहिले. So pectoralis minor is originating from the lateral surface है. Anterior surface भन्दा पनि भयो है. So pectoralis minor is originating from the anterior surface है. यो origin कहाँ हो? Anterior है. Anterior surface of third, fourth and fifth है. Fifth ribs है. Third, fourth and fifth ribs near the coastal cartilage. Near the coastal cartilage है. Coastal cartilage को नजिक है. Third, fourth, fifth rib हेर्दा. This is the coastal cartilage. Okay, this is the coastal cartilage. This is the coastal cartilage. Okay, this is the coastal cartilage. So guys, यहाँ हेर है. So coastal cartilage को नजिक है. Third, fourth, fifth rib. This is the first rib. Second, third, fourth, fifth. So third, fourth, fifth rib को coastal cartilage नजिकैको anterior surface बाट चाहिँ origin भएको छ है. So this is the origin of the pectoralis minor. This is the pectoralis minor muscle है. And it's inserted in the coracoid process है. Okay, यसको insertion चाहियो है. So insertions कहाँ हो भन्दाखेरि it is inserted in the medial border, medial and the superior surface है. It is inserted in the medial and superior surface है. Medial and superior surface of coracoid process है. Coracoid process of scapula है. Scapula को coracoid process मा insert हुन्छ है. So coracoid process को scapula coracoid process of scapula मा चाहिँ insert भयो. So this pectoralis minor is supplied by a nerve है. Nerve supply के हो? So nerve supply के हो यसको चाहिँ? यसको nerve supply हो. This is the medial pectoral nerve. This is a medial pectoral nerve है. This is supplied by the medial pectoral nerve. So medial pectoral nerve it supplies the pectoralis minor and the pectoralis major, while the lateral pectoral nerve supplies only pectoralis major right? Also it has some fibers for the pectoralis minor and generally so यसो हुन्छ के. So median pectoral छ नि यो median भन्दा पनि median हो है. Sorry, median है. That is the median pectoral nerve. Median pectoral nerve छ नि यो median pectoral nerve. That is the median pectoral nerve. Medial नै हो. So medial अरे यार ठीक छ यसलाई कट गरौँला केही छैन. So medial pectoral nerve है. So medial pectoral nerve. So medial pectoral nerve छ नि medial pectoral nerve supplies the pectoralis minor है. Pectoralis minor plus pectoralis major के major. So it purses है. It purses छेड्छ के. It purses pectoralis minor है. So minor लाई छेडेर it purses pectoralis minor to supply major है. To supply major. So major लाई supply गर्नलाई यसले चाहिँ minor लाई छेडेर जान्छ के. So यहाँबाट चाहिँ pectoralis minor major के medial pectoral nerve निस्कन्छ. That supplies the pectoralis major also है. So median pectoral nerve ले चाहिँ medial pectoral nerve ले चाहिँ pectoralis minor लाई छेड्ने भयो. तर lateral pectoral nerve ले चाहिँ pectoralis minor लाई छेड्दैन. यसले चाहिँ clavipectoral fascia छेडेर चाहिँ आउँछ है. So and there is another muscle है. Another muscle यो देखिने muscle. There is a subclavius muscle which is originated from the junction of the it originates from the junction है. It originates from the junction of first rib and its coastal cartilage and its coastal cartilage है. Cartilage बाट चाहिँ origin गरे आउँछ and it is inserted into the इसको insertion in the subclavian group है. Subclavian group. So there is subclavian group where the insertion of the subclavius occurs है. There is subclavian group in the inferior surface of the clavicle. And okay यो पनि भयो है. So this is supplied by subclavius muscle is supplied by the subclavian nerve है. That originates from the upper trunk है. Upper trunk बाट origin हुन्छ. And there is another muscle known as the serratus anterior. That is the boxer's muscle है. That is the boxer's muscle. So there is another one known as serratus anterior. So serratus anterior or known as boxer's muscle है. Boxer's muscle. So muscles, it helps in the protraction of the scapula. Okay? It is in the protraction of the scapula. So it originates from the origin. So serratus anterior origin. It originates from external surfaces. Right? External surfaces of lateral parts of first 2 8 ribs. So this is the first 8 ribs. This was second, third, fourth, fifth, sixth, seventh, eighth है. कता मिस भयो. सो यसरी चाहिँ ओरिजिनमा हुन्छ है. सो यहाँ चाहिँ के भयो यो चाहिँ फर्स्ट कुन हो छोडिदियो. यसलाई चाहिँ छोडिदियो. फिगर चाहिँ अलिकति मिस्टेक जस्तो लाग्यो. सो फर्स्ट 2 8 ribs है. फर्स्ट टु 8 रिब्सको ल्याटरल सर्फेसबाट के ल्याटरल पार्टको एक्सटर्नल सर्फेस चाहिँ भन्नुको अर्थ तिम्रो यो ल्याटरल भागतिर के यो चेस्टको ल्याटरलतिरको रिबको एक्सटर्नल सर्फेसबाट के यो चेस्टको यो ल्याटरल साइडतिर भयो दिस ल्याटरल साइड है दिस ल्याटरल साइड जस्तो भयो नि यो ल्याटरल साइडको एक्सटर्नल सर्फेस भनेको यो भयो दिस एक्सटर्नल सर्फेस अफ द ल्याटरल साइड अफ द यो चेस्ट है यसरी चाहिँ ओरिजिनमा आउँछ सो ओरिजिन यहाँ हुन्छ अनि इन्सर्सन चाहिँ कहाँ हुन्छ सो देयर इज द इन्सर्सन है सो इन्सर्सन अफ द सेराटस एन्टेरियर इन द एन्टेरियर सर्फेस है in the anterior surface of medial border right anterior surface of medial border of scapula so scapula ko medial border ko anterior surface hai so anterior surface and medial border so this is the medial border there is insertion of the serratus anterior serratus anterior ko insertion चाहिँ यहाँ हुन्छ हेर्नु त so serratus anterior को काम is the main muscle which helps in the protraction of the scapula के scapula like along the wall तान्ने गर्छ so this is the main action it helps in the rotation of scapula also helps in the rotation of scapula लाई गराउनु भयो rotation of scapula गराउने भयो and it protract the scapula के protract the scapula and holds it against the thoracic wall thoracic wall सँग होल्ड गराउने भयो scapula लाई चाहिँ है so it is supplied by nerve okay nerve supply के हो भने यसको nerve supply is a long thoracic nerve है which arises from the roots of the C5 C6 and C7 है so root बाट आउँछ है long thoracic nerve of the brachial plexus so if this long thoracic nerve is injured भयो भने there will be the paralysis of the serratus anterior known as the serratus anterior paralysis or boxer's paralysis simply paralysis of serratus anterior है so serratus anterior को paralysis भइसकेपछि तिमीले यो उसलाई के अरे यो आर्मलाई तिमीले यो आफ्नो ह्यान्डलाई यो वालको अगेन्स्टमा पुश गर्यो अथवा कसैलाई पञ्च गर्यो भने push अथवा punch गर्यो भने तिम्रो यो scapula will not be protracted and the medial border and the inferior angle this inferior angle and medial border is unduly prominent it appears prominent so this condition is known as the winging of scapula this condition is known as the winging of scapula को winging भन्छ के so there will be the winging of scapula and in this condition the medial border and the inferior angle is unduly prominent यो medial border and the inferior angle becomes prominent so medial border and the inferior angle becomes prominent and there will be the winging of scapula due to the paralysis of the serratus anterior caused by the injury to the long thoracic nerve यो बुझिरहेको यहाँ हेर so same condition so this is the medial border and this is inferior angle this is inferior angle so there will be prominent भयो नि त यो देखियो नि त यस्तै prominent देखिदैन के normally so this is the condition of winged scapula winged scapula this is the winged scapula okay guys so same figure okay this is the sternocostal head of the pectoralis major pectoralis major and there is the clavicular head same figure and okay inserted in the lateral lip of the bicipital group को अथवा intertubercular sulcus अथवा intertubercular sulcus को lateral lip मा insert भएको छ and there is the origin of the this is pectoralis minor which is originated from the external surface of the lateral part of the ribs near the coastal cartilage नजिकै छ अनि यसमा चाहिँ junction of the coastal cartilage of the first rib and inserted into the subclavian group of the clavicle and it is inserted into coracoid process of the scapula coracoid process of the scapula and this is process the clavipectoral fascia and there is the lateral pectoral nerve and the cephalic vein and the thoracoacromial vein or the thoracodorsal vein thoracodorsal artery thoracoacromial artery भन्छ सायद thoracoacromial artery है there is the cephalic vein यसरी चाहिँ हुन्छ यदि देखाउनलाई मात्र this is cut pectoralis major there is cut pectoralis major and this is cut section of the pectoralis major cut section of pectoralis major there is a large deltoid and there is trapezius यो पनि भयो है so and so this is the lateral pectoral nerve this is lateral pectoral nerve which supplies the pectoralis major this is pectoralis major this is pect major this is major and major cut गरेपछि बल्ल you can see the pect minor this is pect minor so pect minor this median nerve process यसले छेडेर आयो it supplies the pectoralis major so median pectoral nerve process the pectoralis minor and supplies the pectoralis major so pectoralis major is supplied by both lateral pectoral nerve and the medial pectoral nerve while the pectoralis minor is supplied only by the medial pectoral nerve so there is the latissimus dorsi which is the muscle of the back so it is inserted in the floor of the bicipital group and there is serratus anterior which is supplied by this long thoracic nerve this is a long thoracic nerve so it supplies the serratus anterior and this these are the thoracodorsal nerve which supplies the latissimus dorsi. There is thoracodorsal nerve. Okay, long thoracic nerve that supplies serratus anterior. Thoracodorsal nerve supplies latissimus dorsi. And there is the brachial plexus. Okay, brachial plexus. You can see this is the basilic vein and this is the cephalic vein. Okay, यति नै हो यसमा देखाउन खोजे. So again same figure. So breast मा आउँछ यो कुरा. So breast को चाहिँ arterial supply हुन्छ हेर्नु भने चाहिँ. So this is the thoracic artery, and thoracic artery को branches supply the breast. Also this is the lateral thoracic artery and this is the internal thoracic artery. So lateral thoracic artery को branches, there are the lateral mammary branches lateral mammary branches, and there is the medial mammary branches medial mammary branches. This is internal thoracic artery. Okay, मैले भनिसकेको थिएँ, this is internal thoracic artery and this is lateral thoracic artery, and there is the thoracodorsal artery also, thoracodorsal artery. यसरी चाहिँ खासमा it is supplied by the lateral mammary branches and internal medial mammary branches of the lateral thoracic artery or internal thoracic artery. So lateral thoracic artery र internal thoracic artery को lateral branches है, lateral mammary branches भयो. lateral mammary चाहिँ internal को चाहिँ there is the medial mammary branches supplies the breast है. So त्यही कुरा हो, लगभग सेम हो, कम्प्लेक्स देखाउन खोजेको. This is the anterior and the posterior circumflex femoral artery. This is anterior and the posterior circumflex femoral artery, and this is the axillary artery, and this is subclavian artery, and behind the teres minor this is the brachial artery. And okay guys, this is thoracoacromial artery, and so the oil चाहिँदैन. So breast मा जाम है. So breast मा पढौँ है. So muscle को कुरा गरियो, chest को muscle को कुरा चाहिँ there will be pectoralis major, minor, subclavius, and the serratus anterior, चारवटा muscle कुरा गरियो. अब breast मा जाम है. Breast are the modified, these are the modified है, these are modified apocrine sweat gland है. These are modified apocrine sweat gland that is present in the both, in case of both, but that is more pronounced in the case of female है. So it is rudimentary. It is present in males but it is rudimentary है. It is rudimentary in males मा चाहिँ rudimentary हुन्छ, and it is developed in female है. Developed in female after puberty है. And okay, during puberty, after puberty, the growth of the female breast is mainly by the deposition of fat है. Deposition of fat है. Fat influence of the ovarian hormones like estrogen है. Estrogen is responsible for the development of the breast है. And the shape of breast is somehow conical or hemispherical है. Conical and hemispherical. Okay, conical and hemispherical. And in case of the older women, or in case of the in old life or late life, the breasts are pendulous. LOUS, pendulous means they are swinging type. So this is pendulous breast in the later stages of the life. And the shape of, okay, यो भन्दा अगाडि पनि lymph nodes नपढौँ है. So पहिला breast कै कुरा गरौँ है. So breast मा चाहिँ it lies in the front of the chest in the superficial fascia है. Front of the chest है, it lies in the front of the chest है, front of the chest in the superficial fascia है, in the superficial fascia है, it lies in the superficial fascia है. So अर्को फिगर होला नि यहाँ तलपट्टि. ओके, यहाँ चाहिँ लेख्न मिल्छ. And the breast extend लेख्यो है vertically it extends from the second to sixth ribs है. And the nipple, this is the nipple guys, this is the areola and this is the nipple. Okay, this nipple lies in the fourth. So nipple lies in the fourth intercostal space है. Fourth intercostal space. And horizontally, okay, horizontally it lies from the sternal line. So horizontally it lies from the lateral margin of sternum. Lateral margin को lateral margin to the mid-axillary line है. To the mid-axillary line. So lateral margin of sternum and mid-axillary line horizontally. And it is seated on the three muscles है. So breast is seated in three muscles है. तिमीले three muscles थाहा हुनुपर्छ. So there are three muscles in beneath the breast है, in the breast lies है. So three muscles है. There are three muscles in which breast lies है. Three muscles. One is the most prominent muscle, that is the pectoralis major, and another is the serratus anterior, and another is the external oblique muscle of the abdomen है. External oblique muscle है. This external oblique muscle of abdomen है. Abdomen को external oblique muscle. So external oblique muscle of the abdomen, serratus, anterior, and pectoralis major. Three muscles that form the bed for the breast. Right? That form the bed for the breast. Bed for breast. Okay, three muscles. है याद राखिराख है. So अब चाहिँ so there is the okay the breastलाई चाहिँ it will divide into the ठ्याक्क यो लाइनले चाहिँ यसरी दुईटा लाइनले चाहिँ it will divide into the this is the outer lateral quadrant है. This outer lateral है. This lateral अथवा outer भन्दा पनि यो upper lateral भनौँ. This upper lateral quadrant है. Upper lateral. This is upper medial. This is upper medial है. Medial. This is the lower medial. Lower medial and there is the lower lateral है. Lower lateral है. So lateral यसरी चाहिँ quadrant मा divide गरेको छ. And है so okay and the upper lateral quadrant है there is the extension of the upper lateral quadrant to the axilla is axillary tail है. This axillary tail है. So this is axillary tail है. Simply called axillary tail है. Axillary tail of spines भन्छ है. Axillary tail of spines that passes with the aperture known as foramen of Langer है. Foramen of Langer that passes within the structure or in the pore called within the के भनौँ pore नै भनौँ. So that is the foramen of the Langer. So there is the axillary tail of spines and okay so अब the structure भनौँ है. Structure of the breast. So breast को structure मा okay लाइन ठाउँै छैन यार. कता लेखौँ त भन्दा यहाँ त लेखौँ है. So structure of breast है. So structure of breast को structure of breast को structure है. So breast को structure मा one is skin है. One is skin. Another is the parenchyma है. Parenchyma skin and there is the stroma है. Stroma. So skin covers the gland है. It covers the gland and the following features are seen है in the skin है. So skin मा there is the nipple है. Nipple and covers the whole gland and nipple and areola. You can see in the skin nipple and areola. So nipple and areola. So this is the nipple. This is nipple and this is also the areola. So nipple is a conical or cylindrical projection in the center of areola. So nipple is a conical or cylindrical projection. It is conical or cylindrical projection. Cylindrical projection. Cylindrical projection at the center at the center of areola. Areola को center में there is the conical or the cylindrical projection at the center of areola. And the areola is the pigmented part. The areola is the pigmented part. Areola is yes कस्तो यार. Areola is the pigmented part in the form of circle in the form of circle circle को जस्तो बसेर this is the pigmented part known as the areola. Yes. So this nipple lies in the fourth intercostal space. मैले अनेक भनिसके. So fourth intercostal space को लेभलमा lie गर्छ nipple चाहिँ है. Fourth intercostal space and it is perforated by nipple is perforated by 15 to 20 lactiferous duct चाहिँ perforated by 15 to 20 lactiferous duct है. So यो पनि भनिसके है. How many and skin है. Skin especially in the areola or nipple it is rich in nerve supply. It is rich in nerve supply. Nerve supply मा rich हुन्छ. So it is rich in nerve supply and many sensory organs है. They have many sensory fibers है. Sensory fibers हुन्छ. Many sensory fibers and has sweet and sebaceous gland है. Has sweet and sebaceous gland. Sweet and sebaceous gland है. Sebaceous gland है. So sweet and sebaceous gland हुन्छ है. So okay यो areola छ नि. Areola in pregnancy. Areola in pregnancy. Pregnancy मा areola it gets exclusively or extensively dark है. It gets dark. It's dark हुन्छ है. Areola is dark in pregnancy and it is rich in sebaceous gland है that are devoid of hair and fat. So यो कता लेखौँ यार. Areola okay. Areola छ नि it is rich in sebaceous gland. It is rich in sebaceous gland and devoid of fat and hair है. Fat and hair. So fat and hair. Fat र hair पनि हुँदैन र sebaceous gland चाहिँ हुन्छ है. So sebaceous gland चाहिँ हुने भयो. And अझ एउटा स्पेशल पोइन्ट के हो भन्दा so यता लेखौँ है. So the areola becomes enlarged है. Becomes large during pregnancy. Pregnancy मा large हुने नै भयो है during pregnancy and lactation and forms a raised tubercle. That forms a raised tubercles है. Raised tubercles known as के भन्छ भन्दा यसलाई is known as यो Montgomery's मेरिज ट्युबरकल है। सो अलि साइज सानो गरौँ यार। मोन्टोगोमेरिज ट्युबरकल है। सो मोन्टोगोमेरी ट्युबरकल है। सो इट इज कॉल्ड एज मोन्टोगोमेरिज ट्युबरकल है। सो दिस ट्युबरकल helps to in the lubrication है। So it produces the oily secretion है। It produces oily secretion that help in lubrication है during suckling of the baby है। Lubrication है, lubrication during suckling of by baby है। Suckling of by baby, suckling by baby। So baby ले milk suck गर्दाखेरि this produces the oily secretion that lubricates the nipple है। So nipple लाई lubricate गर्ने काम गर्छ है। ओके सो स्किनको कुरा यति थियो। सो प्यारेन्ट गाईमा अलिक तल लेख्छु म लुकै लास्टमै लास्टमा लेखौँ है। सो देयर इज द प्यारेन्ट काइमा एन्ड प्यारेन्ट काइमा है। इट इज द प्यारेन्ट काइमा है। सो प्यारेन्ट काइमाको कुरा गर्नुपर्दा इट इज मेड अप अफ ग्ल्यान्डुलर टिस्यू है। ब्रेस्ट इज मेड अप अफ ग्ल्यान्डुलर टिस्यू। ओके ग्ल्यान्डुलर टिस्यू द्याट्स प्रड्युसेस मिल्क है। ग्ल्यान्डुलर टिस्यू द्याट consist of 15 to 20 lobes है। 15 to 20 lobes, there are 15 to 20 lobes है। and each lobes है, each lobes has several lobules, each lobes have several lobules है, lobules है, several lobules and each lobules has sorry okay each lobe has several lobules है, several lobules and each lobule है। so each lobule है, each lobule has, each lobule has है, each lobule has large number of the each lobule has cluster of the alveoli, cluster of alveoli हैन, cluster of alveoli which opens into the lactiferous duct, which opens into the lactiferous duct। सो मैले के भने भन्दाखेरि सो देयर इज प्यारेन्ट गाईमा चाहिँ ग्ल्यान्डुलर टिस्यू हुन्छ। ग्ल्यान्डुलर टिस्यू चाहिँ 15 to 20 लोब्स हुन्छ। बाई सो दिस लोब्स इज फर्म बाई द लिगामेन्ट अफ द ब्रेस्ट नट इज द सस्पेन्सरी लिगामेन्ट है। सस्पेन्सरी लिगामेन्ट अफ कुपर्स है। सस्पेन्सरी लिगामेन्ट अफ कुपर्स है। Suspensory ligament of the Coopers that divides the breast into the 15 to 20 lobes and each lobes has the several lobules. Each lobes has several lobules, several lobules and each lobules contain cluster of the alveoli and this cluster of alveoli produces milk that is drained in the lactiferous duct and these branches unite to form the larger branch of the duct है। So each lobe is drained by the lactiferous duct है। So each lobe is drained by lactiferous duct, each lobe is drained by lactiferous duct है। lactiferous एउटा लोबलाई ड्रेन गर्छ, एउटा lactiferous ductले एउटा लोबलाई ड्रेन गर्ने भयो। सो देयर आर द 15 to 20 देयर आर 15 to 20 lactiferous duct है। lactiferous duct 15 to 20 हुने भयो किनभने देयर आर 15 to 20 lobes सरी 15 to 20 lobes हुनाले 15 to 20 lactiferous duct हुने भयो that drains to the nipple है। सो निप्पलमा लाने भयो मिल्कलाई। सो बिफोर रेचिङ द निप्पल द टर्मिनल पार्ट अफ द lactiferous duct is dilated है। सो टर्मिनल पार्ट अफ lactiferous duct है। टर्मिनल पार्ट अफ lactiferous duct is dilated है, is dilated। सो टर्मिनल पार्ट अफ lactiferous duct is dilated to form lactiferous sinus है। lactiferous sinus है और एम्पुला है और एम्पुला। सो इट टेम्पोरली स्टोर द मिल्क है, इट टेम्पोरली स्टोर द मिल्क है। एन्ड अब स्टोमाको कुरा गर्छौँ भने देयर इज द फिब्रस है, देयर इज स्टोमा है। स्टोमा मैले अघि भनिसकेँ स्टोमामा देयर इज द फिब्रस एन्ड द fibrous component and it is well as the fatty component है। so fatty component is formed by deposition of fat and the fibrous component is formed by the suspensory ligament है। so suspensory ligament of Cooper's भन्छ है। Cooper's को suspensory ligament of the Cooper's ले चाहिँ it divides the breast into the breast glandular tissue into the 15 to 20 lobes and the fatty tissues forms the fatty stroma है। so स्टोमामा त्यति नै कुरा थियो। द्याट फ्याट फर्म्स द मेन बल्क है। सो फ्याट इज डिस्ट्रिब्युटेड अल ओभर द ब्रेस्ट है। फ्याट इज डिस्ट्रिब्युटेड वान पोइन्ट है। फ्याट इज डिस्ट्रिब्युटेड अल ओभर द ब्रेस्ट ब्रेस्टको जतासुकै हुन्छ एक्सेप्ट है, एक्सेप्ट बिनिथ है, एक्सेप्ट बिनिथ द निप्पल एन्ड एरियोला है। निप्पल र एरियोला बाहेक सबैतिर हुन्छ निप्पल एन्ड एरियोला ओके। सो निप्पल र एरियोला बाहेक जतासुकै फ्याट हुने भयो। सो यति थियो यसमा चाहिँ ब्रेस्टमा चाहिँ। ओके लेट्स गो टु दि नर्भ सप्लाई। ओके नर्भ सप्लाईमा चाहिँ ओके नर्भ सप्लाई अफ द ब्रेस्ट है। सो ब्रेस्ट इज सप्लाइड बाई द एन्टेरियर है, एन्टेरियर एन्ड ल्याटरल है, एन्टेरियर एन्ड ल्याटरल क्युटेनियस ब्रान्चेस है। एन्टेरियर ल्याटरल क्युटेनियस ब्रान्चेस अफ द फोर्थ फिफ्थ एन्ड सिक्स्थ इंटरकोस्टल नर्व्स है, इंटरकोस्टल नर्व्स। सो So it is supplied, breast is supplied by the anterior and lateral cutaneous branches of the 4th, 5th and 6th intercostal nerves है. So breast is simply supplied by intercostal nerves. यति सम्झनु न, intercostal nerves ले supply गरेको हुन्छ है. So it is supplied by the intercostal nerves, cutaneous branches of the intercostal nerves है. So यति चाहिँ nerve supply मा तिमीले याद राख्नु पर्यो है. So अब चाहिँ हामी माथि जाउँ है. So अब माथिमा हामी कहाँ पुगेको थियौँ भन्दाखेरि there is the lymphatics मा पुग्यौँ है. Okay, lymphatics मा कुरा गरौँ. So there is the fat है. अन्य देखाउनु पर्दा this is fat है, fatty layer, fatty tissue division except in the areola मा बाहेक अन्त जतासुकै fat चाहिँ. So there is also fat. This is fat. This is the granular tissue. Granular tissue. Okay. Tissue, and this is the lactiferous duct. These are ducts. Okay. This is also fat. And there is the pectoralis major, which is covered by the pectoral fasciae. So pectoralis major is covered by the pectoral fascia. अझै एउटा कुरा गर्नु, चेस्टमा चाहिँ अझै एउटा कुरा गर्नु छुट्यो कि. one स्पेशल पोइन्ट है. ओके, एउटा कुरा चाहिँ के भन्दाखेरि चेस्टमा there is a special fascia known as clavipectoral fascia. Clavipectoral fascia, pectoral fascia. The clavipectoral fascia because it originates from the clavicle. Okay, so this is the transverse section of the clavicle. Right? This is transverse section of the clavicle. And there is a subclavius muscle. Right? This is subclavius muscle, and it is covered by the clavipectoral fascia. It originates from the subclavius, and there is the pectoralis minor, and there is the pectoralis minor. Okay, guys, there is pectoralis minor, which is again covered by the clavipectoral fascia, and it continues downwards and it terminates at the axillary fascia. Right? The axillary fascia. So this is the costocoracoid membrane. This is costocoracoid membrane. This is costocoracoid membrane, and this is the clavipectoral fascia. This is clavipectoral fascia, and this is suspensory ligament. So this is suspensory ligament. So this terminates at the axillary fascia. And this is subclavius, and there is the pectoralis minor. This is pect minor. Okay, this is the clavicle. So there is the characteristic fascia known as the clavipectoral fascia that covers the pectoralis minor, and the costocoracoid membrane that connects the subclavius and that connects the fascia of the subclavius and the clavipectoral fascia, and it terminates downward is suspensory ligament and ultimately fuses with the axillary fascia. So यसरी चाहिँ सम्झ्यौ है. Okay, अब हामी कहाँ थियौँ? Okay, यहाँ थियौँ है हामी कहाँ. Okay, lymphaticsमा जाउँ. Okay, lymphaticsमा हेर्छौँ भने so the lymph nodes चाहिँ breastलाई drain गर्ने lymph nodes there are the there are axillary lymph nodes है. breastलाई drain गर्ने चाहिँ lymph nodes छन् के, there are the axillary lymph nodes है. One is axillary lymph nodes है, axillary lymph nodes, and another is the parasternal lymph nodes है. Parasternal sorry यो कस्तो यो लेख्ने यो ब्रसको थिकनेस घटाउनु पर्यो. there is the parasternal है, there is the parasternal है, parasternal lymph nodes, and there is the अर्को चाहिँ हाम्रो there is the subdiaphragmatic or subperitoneal lymph plexus है that drains the lower and inner quadrant है. lower medial quadrant लाई चाहिँ drain गर्छ है यसले. अनि parasternal चाहिँ upper and the medial quadrant, axillary चाहिँ most of the part of the lymph nodes है. so axillary lymph nodes मा चाहिँ you can see over here है. so axillary lymph nodes मा चाहिँ there are the 5 axillary lymph nodes. Axillary lymph nodes चाहिँ कतिवटा हुन्छ है? 5 वटा हुन्छ के. there is the apical axillary lymph nodes, central axillary lymph nodes, and there is the lateral axillary lymph nodes, and there is the anterior axillary lymph nodes, and there is the posterior. कता गयो? posterior छैन. so apical कतिवटा भयो? apical, lateral, central, anterior, and the posterior. चाहिँ okay, submammary, paramammary lymph nodes होइन, interpectoral lymph nodes पनि होइन. यहाँ चाहिँ posterior sorry यहाँ चाहिँ subscapular axillary lymph nodes के. so subscapular axillary lymph nodes लाई चाहिँ posterior पनि भन्छ है. so this is also known as posterior है. this is posterior, and this is the pectoral पनि भन्छ यसलाई चाहिँ pectoral पनि भन्छ. so anterior or pectoral भन्छ. and there is central, apical, and lateral चाहिँ humerus तिर हुन्छ. so this is present in the lateral side है. lateral side मा हुन्छ. so subscapular is present along the subscapular vessel है. so this is called posterior, and it is present in the anterior or the pectoral side तिर हुने हुनाले चाहिँ यसलाई pectoral lymph nodes पनि भन्छ. अनि there is the central lymph nodes है. so central lymph nodes occurs in the central fat of the axilla के. axilla को fat मा हुन्छ. and there is apical lymph nodes just above the central lymph nodes है. central lymph node को माथि चाहिँ apical lymph nodes हुन्छ है. so there is the central lymph nodes, and there is the apical lymph nodes है. so यसरी हुन्छ के. okay, so यहाँ पनि हेर्न सक्छौ there are pectoral group of axillary lymph nodes. there are anterior पनि भन्छ है. there are anterior also. there are internal thoracic mammary nodes है. internal thoracic mammary nodes are parasternal nodes पनि भन्छ है. एन्ड यहाँ एउटा इन्ट्रेस्टिङ कुरा चाहिँ दिस मिडल साइडको लिम्स चाहिँ इट एनास्टोमोसिस विथ द लिम्फेटिक्स अफ द अपोजिट ब्रेस्ट है सो इट एनास्टोमोसिस है इट जोइन्स द लिम्फेटिक्स द अपोजिट ब्रेस्ट सो द्याट any cancer cell any malignant neoplasm here hey, can travel to the another breast hey. So any malignant neoplasm any malignant neoplasm can travel to the another breast so through the anastomosis with the lymphatics of the opposite breast any malignant neoplasm within one breast can travel to the another breast because the lymphatics of the one breast is anastomosis with the lymphatics of the opposite breast there's internal thoracic or membrane lymph nodes or parasternal nodes and these are the pectoral group of lymph nodes that drains in the apical group of lymph nodes so यो कुरा भयो एक्चुअली lymph nodes को कुरा पनि भयो lymphatic drainage मा अब यहाँ हेरै सो simply there is the okay there is the plexus plexus known as subaerial plexus of Sape there is the plexus around the just beneath the nipple so this is the plexus this is known as subaerial plexus of Sape subaerial areolar plexus the subaerial plexus of Sape भनेको subaerial plexus छ there is the subaerial plexus of Sape and okay okay this is drained into the parasternal lymph nodes or internal mammary lymph nodes this internal mammary lymph nodes the rotor's node so rotor's node is the interpectoral node this interpectoral node so pectoral node this rotor's node is present between the pectoralis minor and major so rotor's node is present between the pectoralis minor and major and there is central axillary deep lymph nodes and there is lateral nodes and the subscapular or the posterior lymph nodes and the pectoral or the anterior lymph nodes so pectoral or anterior and subscapular and posterior lateral central and the apical apical गरेर यसरी 5 वटा axillary lymph node हुन्छ so axillary lymph node को नम्बर सोल्सले सोध्यो भने there are about 20 to 30 axillary lymph nodes and okay guys अब चाहिँ यसमा त्यति नै थियो same subaerial plexus of Sape there is a parasternal or internal thoracic lymph node in here is a parasternal or internal thoracic lymph nodes and there is interpectoral or rotor's node that is present in the pectoralis major and minor and there is infraclavicular and the supraclavicular lymph node so there is apical lymph node there is central lymph node there is lateral lymph node or there is posterior there is lateral and there is posterior and there is anterior so anterior lymph nodes are the drained first so यसमा चाहिँ त्यति नै हो this anterior axillary lymph nodes or pectoral nodes and posterior axillary node lateral central apical okay these are 5 axillary lymph nodes and there is pectoralis minor this is axillary vein okay so यहाँ पनि त्यस्तै हो ओके मैले लिम्फलाई चाहिँ धेरै गरेको छ there is subaerial plexus of Sape this subaerial plexus of Sape which is drained into the anterior or pectoral group of lymph nodes pectoral group of lymph nodes and there is the posterior and there is drained in central बाट lateral बाट apical बाट subclavius trunk मा or supraclavicular भन्छ चाहिँ so let's go to the applied or clinical aspect applied or clinical aspect मा जाम यो pedo appearance of the okay pedo appearance भनेको अब if there is the malignant neoplasm there is the metastasis of the malignant neoplasm that block the lymphatics there will be the lymph edema lymph edema हुन्छ lymph edema there will be lymph edema there will be lymph edema and the lymph edema result in the swelling and there will be the if the cancer cell also infiltrate in the lactiferous dogma infiltrate गर्यो भने there will be the retraction of nipple or simply the suspensory ligaments will be retracted that so the nipple is retracted here and it gives a characteristic shape of the peel of the orange so this is PD orange appearance भन्छ यसलाई चाहिँ so सुन्तलाको बोक्रो जस्तो देखिने हुनाले it is a PD appearance and there is the unduly prominent pores like or dimples like pores these are the dimples like pores which is resulting from the accumulation of the lymph so as you can see over here यहाँ चाहिँ देखिन्छ so vascular sign there will be dilated superficial blood vessels there is the carcinoma if there is carcinoma there will be the dilation of the superficial vessels and there will be skin edema with the PDU appearance skin edema there is skin gland orifice these are skin gland orifice and there will be the lymph accumulation there is subcutaneous lymphatics okay carcinoma this is carcinoma and there is involvement and obstruction of the subcutaneous lymphatics by tumor result in this lymphatic dilatation and lymph accumulation in the skin resulting edema creates orange peel appearance due to the prominence of the skin gland orifice so skin gland orifice को prominence currently it results in the formation of the PD orange appearance so simple यहाँ पनि त्यस्तै PD orange appearance this is a retracted nipple okay guys okay so okay यो जुन चाहिँ this is known as the this infiltration of the lactiferous duct and their consequent fibrosis so this infiltration of lactiferous duct and consequent fibrosis which causes retraction of nipple retraction of nipple get retracted nipple retraction भयो है so there is another you expect this infiltration of the suspensory ligament of the cancer shortening of the contraction of the ligament so there is infiltration of the cancer cell which is called the retraction retraction of suspensory ligament suspensory ligament suspensory ligament को retraction भयो किनभने cancer cell infiltrate भएर and there is something called is the memories or memory crest memories or memory crest भनेको that is the line that is present during the embryonic development that extends from the axilla to the inguinal line inguinal region सम्म के so यसरी चाहिँ extend भएको हुन्छ and they were based over the memory trees or memory crest and this is formed by the during embryonic life so the all the memory this accessory nipples these all the nipples were degenerated during development except in the region of the pectoral region which results in the nipple in the breast then you say you resulting your breast को nipple चाहिँ degenerate हुन सकेन भने चाहिँ there will be the supernumerary nipples in the after birth पछि supernumerary nipples हुन सक्छ and there is the another condition known as there is the polythelia polythelia and if there is no nipple there will be athelia and if there are two breasts or two or more breasts there will be polymastia if there is no breast there is amastia and there is something called as gynecomastia gynecomastia भनेको simply this is the development of breast development of breast in men breast in men मा breast development हुनु gynecomastia so and yeah so these are the lactiferous duct lactiferous duct are present radially they are present radially so to avoid cutting of the lactiferous duct so surgeon make a radial surgical incision so radial surgical incision known as a Langer's line भनी भन्छ यसलाई so Langer's line को around मा चाहिँ सर्जरी गर्नुपर्छ सर्जनले चाहिँ भन्ने कुरा हो so यति हो गाइज यति हो